Dear viewers, we have been joined by our first guest for this evening, board-certified behavior analyst, Fajer Al Manaie. Good evening, Fajer.
Good evening. Thank you for having me.
Thank you so much. It's our pleasure. And we're going to be talking about something really important today to do with children and their behavior. But in the beginning, what is ABA, which is Applied Behavior Analysis, and how can it help?
So ABA is actually the only science-based research that's proven to help children with autism. It is basically the science of behaviors, and we study the specific behaviors in order for us to create intervention plans that can help change behaviors.
Okay, so it's something that parents do need to be aware of. Okay, perfect. So ASD, which is autism spectrum disorder, is it strictly genetic, or do you think the environmental atmosphere can play a role?
So there isn't conclusive evidence on why autism is caused. A lot of research is leaning towards a neurogenetic reasons, but there's a lot of symptoms that could be showing in children that are caused by environmental factors, because there are two different types of behaviors. There are respondent behaviors, which are basically our reflexes, and those are behaviors that we're born with. And then there are operant behaviors, which are learned behaviors. And so responding to their names or eye contact is actually a behavior that needs to be taught or trained. And so sometimes children might look like they have signs of autism, but they were actually never in a situation or taught how to respond.
Okay, so the parents do play a big role when it comes to that. Perfect. Since we're talking about parents, what signs should parents really watch out for when it comes to these kind of developmental conditions such as ASD and ADHD? We hear a lot about ADHD in schools usually, and ADD. What kind of signs?
So for each developmental disorders, there's a set of signs that people or parents need to watch out for. So when it comes to the signs, a lot of the most important things that we need to do is actually pay attention to the developmental milestones. But we also need to take into account that the developmental milestones are actually an average of what could typically be the range that a child would develop. So it could be off by a few months or even go over a few months, and that's still normal.
Okay, that's so the parents shouldn't be worried if it's just a few months.
I know that you said like ADHD is actually something that has been put in the spotlight recently a lot, and there's a lot of expectations for our children to sit down, especially now with online schooling. And if they've never had to engage in such activities in the past, it's really hard for them to actually comply by sitting down. So for a child, the typical sitting time is 2 minutes for every year of their life. So if they're 2 years old or 3 years old, they're not expected to sit for more than 6 minutes. But now doing online preschool or online schooling, they're not sitting down a lot, and a lot of parents are concerned, and they feel like they're really hyperactive when it's actually within the normal range.
Okay, so parents should look for signs, but when it comes to online schooling, maybe they should wait and understand that the kids have to learn how to sit there for, you know, a long time in front of a screen shouldn't be easy for a kid, I think.
And it wasn't easy for anyone. I know that the shift for us also to start working from home and working through a screen was very difficult. It exhausts us, and so just being a little bit easier on our children is something that we all have to kind of take into consideration.
Of course, yes. So with ASD and ADHD, they have a lot of overlapping symptoms. But what differentiates both? What are the differences between both, and how can the same patient deal with them?
So ADHD is actually a disorder that could also be aligned with ASD. So for autism spectrum disorder, there are a lot of other coexisting conditions that could be in the same diagnosis. So each child could have OCD, they could have anxiety, they could have ADHD, but a lot of the time ADHD is actually confused for something else. So for children with ASD, sometimes they have difficulties learning and acquiring skills, and so they might be showing signs of hyperactivity because they couldn't sit in place, but they're actually trying to get away from a task that they know they have difficulties in. And so also with ADHD, on the other hand, there are a lot of other underlying issues that could be at hand that could present as ADHD, but if we actually try to diagnose it, it might not necessarily be ADHD. And so it's important to go to the right person in order to diagnose ADHD.
Definitely. Always go to a professional when it comes to these things. Google is not enough. I know a lot of people try to just, you know, go online and figure it out on their own. Maybe reading a bit is good, but seeing a professional is more important. Yeah,
and ADHD is a lot more than just the hyperactivity, and so it's a very complex diagnosis to diagnose someone with.
Of course, I can imagine, especially if both of them have similar symptoms and at the same time they're very different. So you do need a complex, of course. So in your experience, what are the difficulties you face when you treat kids in contrast to adults? I know with kids, like even with dentists, you have a dentist that just takes care of kids specifically. How does it work in this situation?
So I'm actually specialized in providing intervention for children. I specialize in early intervention, to be specific. So the age range that I usually work with is around 1.5 years up until, I want to say the oldest is around 7 or 8. And so the parents are usually the people who bring them to the clinic, or the school referred them for a few reasons. And so it's very different having the parent actually bring the clients to this center versus having an adult who has to be consenting and have to be more involved depending on their functioning level, like more involved in the actual treatment plan. They have to be almost like a willing accomplice when it comes to that.
So do you think it's easier to treat children at a younger age, or adults, as you said, that come willingly?
I think it's both very different. When it comes to children, there's a lot that goes into it with working with the parents, and the parents play a really large role, but there's also the aspect of them being so young and so like fresh, so you can actually teach them so much in that at a young age, whereas when they're older, sometimes there are behaviors that are actually harder to change because it's been there and it's been present for such a long time.
And adults is used to certain things they do, and it's hard to just change that. You know, change is not easy at an older age, of course. So how involved do the parents have to be in an intervention or a treatment program? I do understand that they need to bring the child, but what happens after?
So parent involvement is actually very key. It's a caregiver involvement in general, like whether it's a nanny, an aunt, a grandmother, even if it's teachers, because we're trying to teach strategies that are applied in all of their settings. We're trying, in the most part, to teach communication, and so if the communication is only present in the clinical setting, then it wouldn't be applied or generalized to other settings, and we're not really fixing the problem at hand.
Makes sense. So since you mentioned that, is the intervention strictly constrained at a clinical setting, or could it be in another place like the home, or maybe a place the kid likes? How does that work?
So the goal is always to generalize everything that we teach. So the clinical setting is where we kickstart the intervention. It's where we introduce them to new ways of learning, but the end goal is for them to be able to generalize these skills not only in the clinic but also across different people, different environments, and also hopefully to generalize it whenever they actually need to access these behaviors.
Okay, perfect. So it does start at the clinic and then just goes on from there. So I'm sure you have had a lot of scenarios happen in front of you, since you do treat kids at a young age. Can you give us a contrasting scenario with the one where ABA is applied and another where it isn't? What's the difference?
So I know that like a lot of parents' main concerns are child tantrums, and I think this is something that, regardless of the diagnosis, if the child has ASD or any other disability, or even if they're typically developing, that tantrums is something that all parents go through. And so a lot of the time I see parents applying specific strategies at home, but they don't do it in different places. And so like if the child is tantruming in public, the parents give them what they want, and so then the child then learns that, okay, when I'm out in public, my mom doesn't want me to tantrum, and so I can get away with it there. Whereas if ABA was actually applied in that scenario, the child might tantrum a few times, but then he's going to know that it's not going to work anymore, and they're going to end up following instructions.
They have to try something new and actually, you know, follow instructions. So when it comes to disorders, our society is still getting used to that. We have just started recently talking about them publicly and even seeing doctors, you know. So a lot of parents do miss the signs of these disorders. It's either denial sometimes or them being kids. What do you think about that? How can we change that? And what long-term consequences does that apply to the child?
I think the stigma around mental health has changed a lot in the past year. There's a lot more awareness and a lot more education around that matter. I think when it comes to noticing signs in children, parents usually just brush it under the rug because they're 2 or they're 3 years old, and they're like, it's okay, like the child is going to be fine.
That's what a kid does.
Yeah, and it's just kids are kids. And so what I always tell the parents and tell everyone else is that, what does this behavior look like when the child is then 21? So if they're tantruming now at 3 years old, we can still have time to change that, teach them different mechanisms and coping strategies to reduce the tantrums. But if they're 21 and they're in an airplane or in an airport and they're tantruming because they changed their gate last minute, like we're not going to be there to help support and change those behaviors. And so it's always important, even though it looks like it's such a small behavior, to intervene sooner better than later.
Of course, because as you said, I think that's a great thing you mentioned, that they see a 3-year-old tantruming, but they do not imagine the same kid at 21 doing the exact same thing in a public setting. So I think that's a big deal that should push parents to go forward and see a doctor. So you mentioned awareness, which is really important, and that's what's changing the social stigma lately. So we're starting to understand mental illness or disorders more. But what kind of awareness do you think there is still a lack of? Do you think traditional media should focus on this more, or social media?
Definitely. I think the awareness around child mental health is still very lacking. There's a lot of awareness around adults going through anxiety or depression or other mental health concerns, but when it comes to children, there is not a lot of awareness. There's still a lot of denial because they're afraid of a diagnosis. And so I always say that I'm in the service of actually treating and not diagnosing. So the diagnosis doesn't really matter. If they see that there are behaviors that could be intervened on, they can always reach out, and we don't need to take a step that they're not ready for. We don't need to get a diagnosis in order to provide intervention or support.
So you could really take it step by step, so it's comfortable for the parents and the children at the same time.
Yeah, exactly.
Thank you so much for all the information. Do you have any final advice you would like to give parents that are actually watching us and need help with their children? So
just reaching out if you need help, whether it's support for yourselves or support for your child. It's really important to just find a support system, and if you don't have that at home, then reaching out to a professional who's actually trained in supporting parents and supporting children in difficult times is really important.
Of course, early detection, as you said, does help a lot. Thank you for all the information. It was our pleasure to have you.
Thank you so much.
Thank you.